Hello and welcome to Health Chat program. This is a program that looks at health matters and other related issues concerning our health. And so today we are looking at Safe Motherhood Week, which has got a lot of activities in it. And I have a panel of discussants who are going to take us through to see to it that we understand what this week is all about. And I will allow them to introduce themselves. I'll start on my immediate right. Doc, can you kindly introduce yourself?
Thank you so much. I'm Dr. Karen Chizuni. I'm the Chief Safe Motherhood Officer from the Ministry of Health. Thank you.
Thank you for coming. Next.
My name's Wezi Kaonga, doctor by profession. I'm the Sexual and Reproductive Health Specialist working with UNFPA, which is the lead agency in the UN responsible for sexual and reproductive health.
Thank you.
My name is Esther Banda. I'm the Vice President for Midwives Association of Zambia. Thank you.
My name is Dr. Christabel Mbiza, obstetrician gynecologist, here as a member of the Zambia Association of Gynecology and Obstetricians.
Thank you so much and welcome to Zanis.
Thank you.
Yeah, we're looking at Safe Motherhood Week. What is Safe Motherhood to start with?
Thank you so much. So Safe Motherhood is actually a program that focuses on improving the health of the women as well as the children. So specifically we are looking at the mothers and the newborn.
And the newborn.
Yes, so it focuses on reducing the morbidity as well as the mortality for the women and the newborn.
Okay. Any components which are attached to safe motherhood, or it is just that safe motherhood?
So basically it looks at a number of components. So one of them is quality antenatal care, where we look at ensuring that women are checked regularly and also they're given education and as well as counseling. And then it also looks at improving access to the services. So when you look at access, we are looking at geographical access in terms of the distances that they need to cover, and also making sure that they have the finances to make them move to where the antenatal care services are being provided from. And also, we also look at having access to a skilled provider. So we're looking at the provider that is providing the service. So basically, we're looking at is the midwives around, are the obstetricians around, or other healthcare providers that have the knowledge to actually care for the women. And it also encompasses the issues to do with the monitoring, as well as the evaluation, as well as research. So we also monitor to see the progress and also evaluate the impact. So basically, we make sure that women have access to all the services that they need. And we also have they have to focus on ensuring that community engagement is also there, because we speak for the women and ensure that they're supported by their communities to have the services that they need. Okay. So we also look at ensuring that women prepare for their births adequately and also prepare for emergencies in case there's a complication. Okay. So that's what we focus on.
All right, that's quite mouthful, and I know that we're going to come to that component of engaging the community and all that. As UNFPA, what is your role when it comes to this? Before we can talk of the current situation, in the country, what is your role in all this?
Right, thank you so much. Perhaps let me begin by making mention that UNFPA is an agency that works towards ensuring that we deliver a world where every pregnancy is wanted, that every childbirth is safe, and every young person reaches their full potential. And so in the context of safe motherhood, clearly all the components are very important, but maybe for now let me focus on the second thing that I mentioned, making sure that every childbirth is safe. And so UNFPA exists in this country to support the Ministry of Health, to ensure that we translate policy into services. And in this case, in ensuring that every childbirth is safe, one of the things that UNFPA supports is to ensure that every birth is attended by a skilled provider. And in this case, we provide resources to train midwives. And the model that we use is to essentially pick midwives that are serving in some of the remote parts of the country, picking them up when they are general nurses and they would want to pick up midwifery. And so we provide bursaries for such, and clearly then get them bonded to serve in those remote areas to ensure that women in those places also have access to skilled birth attendants. But beyond that, we also support in ensuring that the institutions that conduct these deliveries are well equipped and well prepared to be able to do this. And one of the things that we're preparing to support the Ministry of Health with is to ensure that we can do an assessment that tells us how equipped are we, how ready are we to provide this very much needed service for our women out there, including women that have to access this service within the health facilities in the cities. And so we have a heavy presence in ensuring that emergency obstetric and newborn care is provided across the country, and also be able to prevent some complications that may arise from labor and delivery. So for now, perhaps I can stop there, and we'll be able to share other areas in which UNFPA supports the Ministry of Health.
Great. We're talking maternal health here, the safeness of a mother. And we're talking of, the midwives here. How do you come in this?
Thank you so much. So Midwives Association of Zambia is a professional body that wish to have an empowered midwives. Our major goal is to ensure that we reduce maternal and neonatal mortality. Okay. In the end, we are going to promote the safe motherhood. So safe motherhood, how do midwives come in? Midwives are the first point of contact. Yes. For these women. Actually, it should be before they get pregnant, the time that they are pregnant, the time that they are in labor, and the time that they deliver. So there is evidence that when we have a skilled midwife, then we are going to have reduced maternal and neonatal mortality. Because it's a midwife that we find when you go to the facility who attends to the pregnant woman. So we want a midwife, like Dr. Kaonga has mentioned, part of the partners, major partners that are supporting Midwives Association of Zambia. We want this midwife who is skilled to offer that quality of care to this woman who is pregnant. So when they come for antenatal, are we able to use the skill to screen the woman and detect that they have these problems that come during pregnancy? And we have other women who will get pregnant with already having existing conditions. So we again refer to our friends who have a wider scope of practice. But for us, we have to ensure that the antenatal care is well given, and once they are in labor, do we have a safe space? Do we have running water? How are the mattresses? How is the equipment status in that labor ward? Yeah, and when they deliver also postnatally, how is this baby? How are they going on? Because if we don't have the trained midwives, sometimes it's very difficult to pick the problems that they have. So that is our role. We are the first point of contact. Yes.
Great. Dr. Karen here mentioned that it is quite all-encompassing when it comes to, maternal health issues. You mentioned of other partners or other, professionals that have to be part of this whole. Doc, what is your role when it comes to this maternal issue? Because this is quite critical, as we talk.
So our role is taking or driving from the two speakers that have gone before me.
Yes.
Is you have the midwife, and there are situations where you need the specialist. So basically, at Zago, ours is to ensure that even in the provision of this service, we also help to push and find ways to increase the numbers within the country, so that at the end of it, even in the outskirts, you only just don't have the midwife, but you also have the specialist who's able to assist in handling the complications that are there. Because currently, as a couple, in terms of registration, we're talking about 104 registered obstetrician gynecologists.
Only.
So we are pushing and working together with the Ministry of Health to ensure that you have more people coming on board through our local training, such as the Zambia College of Medical Obstetric, which is ZACOMS, and then there's the EXACOG, the Eastern African, where we are ensuring that we encourage more people to actually want to get on board, because we will not reach the values towards where we want to be in terms of our maternal and morbidity and mortality as a country if we do not have enough people to come on board. So ours is to ensure that we provide that leadership in the specialization of this, so that at least every other place has not only just the midwife or the birth attendant, but also has at least specialists in those. So looking at the number that I've given you, we see that we have a long way to go.
A long way to go.
Yeah.
Okay. Dr. Karen, you've mentioned of so many aspects here which has to do with maternal health. How are we faring currently as a country, and if at all there are any statistics to that, how are we?
Thank you so much. So Zambia has made progress in reducing maternal mortality, but we are not yet where we want to be. So currently we are standing at 187 per 100,000 live births, which is a reduction from the 252 per 100,000 live births that we had in 2018. But we are not yet there, because the global target is to reduce the maternal mortality ratio to less than 70 per 100,000 live births. And when we look at newborn mortality, we have reduced, yes, from 27 per 1,000 to 12 to 17 per 1,000, but our target is to reduce up to 12 per 1,000, sorry, per 1,000 live births, yes, per 1,000 live births. So when we look at adolescent pregnancy, like the teenage pregnancies, we just moved from 29% to 28%. So we still have a lot of adolescents out there that are falling pregnant, and these adolescents are at high risk for dying. So we also need to reduce those numbers. So basically, we are not doing fine. Our unmet need for family planning is still very high. We reduced from 21 to 16%. So this rate is still very, very high. It means that we still have women out there in our communities that would want to use a family planning method but do not have access to family planning services.
I know that when we talk of issues to do with maternal health, it's quite vast, and we can't actually exhaust everything. And now this time around, we are talking of the commemoration of this, Safe Motherhood Week, which has got quite a lot of issues. And I think we can actually look at this. And I know for sure that in the coming episode, we'll be looking at these other issues that we are talking of. Why this commemoration? Do we take it every year, or it is just this year that we are taking part in this year? The commemoration for this year.
Right. Perhaps I can start, and
Yes,
then my colleague from the Ministry of Health will chime in. Like listening to what safe motherhood is and issues related to maternal health. The Safe Motherhood Week gives us an opportunity for heightened services to be delivered within this week. We essentially take the package that my colleague from the Midwifery Association of Zambia went through, highlighting all the way from the pre-pregnancy period of promoting access to family planning, antenatal, labor and delivery, as well as the postnatal period. So in the Safe Motherhood Week, we have an opportunity to provide information around services that are available, but also be able to do heightened service delivery. And in this case, we have communities involved with giving health information around making motherhood safe. We have health facilities involved in ensuring that services are provided in a very quality way. And then the height of the pinnacle of the commemoration this year is happening in Kabwe. And this is where we also have high-profile leadership actually in attendance to just heighten the services that we provide to make motherhood safe. And it resonates very well, as you may know, that maternal health is very dear to our current president, to a point where he's actually made a declaration to ensure that there is a maternity annex at every health facility, just to ensure that everyone has access to services regardless of where they are. So this is an annual commemoration that happens, and what we do is essentially commemorate this in different regions, looking at the statistics that Dr. Karen was providing, or the need that there is at that particular moment for us to be able to amplify the services that we provide. We have many actors that come on board to provide services, especially services that can easily be provided within the community: family planning, health education around motherhood. And in this case, I would also sound a call for men folk to actually be involved, because this is essentially an activity that would actually want everyone on board, particularly being able to provide and burst some of the myths that keep women away from health services and health facilities that essentially are supposed to provide a safe haven for them.
Okay. Doc, you've rightly mentioned that these activities will be happening in Kabwe, meaning all roads will lead to Kabwe. Doc, why Kabwe?
So basically, we were looking at the mortalities, as Dr. Kaunga said. So where are the numbers? So Kabwe is one of the regions or provinces that have high maternal mortality ratios.
Okay.
So they, for example, in 2024, they lost 62 women. So if we brought those 62 women here in this room, I think this room will be full of dead bodies.
Oh, yes.
So they are one of the provinces that have high mortalities, and want to see how best we can now heighten the provision of services in that location, and see how much we can give information, how much information we can give to the community on the availability of the services that can actually be able to prevent those mortalities, or actually be able to prevent women from dying in the similar way other women died last year. So we'll do a number of activities, as my colleague has mentioned. So ranging from just giving information, but to also be able to provide actual services like family planning, antenatal care services, ultrasound scanning, and many other activities that the women need.
Okay.
Yeah.
Zago, what is your role? Why are you part of this?
We are the frontliners. So even as we're speaking now, services are still continuing. You have women that are coming to our institutions, either Levy or UTH, to be seen by specialists, so that they get the full package that we're talking about in terms of our antenatal care. So whilst everybody as roads are leading towards Kabwe, the rest of Lusaka continues to ensure that the services within the different regions, not just Lusaka, but the rest of the country, continues to be seen by us, the obstetricians, our midwives, and our health cares throughout, so that at least everybody is seen by a skilled worker, even as we aim to ensure that we're reducing maternal mortality.
Great. Midwives, why being a part of this? Because we are looking at it, just as Dr. Christine here has mentioned. Why not just be in Lusaka? Why do you want to be part of this activity? You know, Safe Motherhood Week. Why would you want to be part of it?
So a pregnant woman is all over
Everywhere.
the country. And Midwifery Association of Zambia has presence in all the 10 provinces.
Okay.
So this is a special week to us. As already mentioned earlier, that we are the primary contact. It's a very special week, and we are creating awareness so that people know. Others don't know that pregnancy actually is a risk. So as Zago has mentioned, our role as midwives is to attend to normal pregnancy, delivery, and maybe low risk. But then when it comes to higher risk, we we give it away to our specialists. So why midwives? Midwives are skilled birth attendants, and they are trained to look after the mother and baby so that we have a positive pregnancy outcome. So this is the time that we are ensuring that we promote outreach services where midwives go out in the community. We work with the other community members, the Safe Motherhood Action groups, who help us from the community, who help us to identify the women that are pregnant and those that have that need skilled attendance. So they push them to the facilities, and in the facility we want them to find skilled attendants so that these skilled attendants are able to offer the quality of care that is needed, be it during family planning when they should have access to contraception. And this access should not only be to elderly women, even the adolescents, because we have seen that we have a lot of pregnant adolescents, and this is the time that we want, if there's a way of seeing these adolescents separately apart from the elderly women, I think that would also be good. So we are there and we want all these areas, the components of safe motherhood, which is family planning, access to contraception, antenatal care, not just antenatal care, but quality antenatal care, where we want women to come to have almost 8 contacts. Okay. Yes.
All right. I know we can go on and on, but because of the limitation of time, I'll allow Dr. Kaonga to come in a little bit late as we close. So I'll start with Dr. Christine there. Your last word of appeal to the general public.
To the general public, the reason why we are in this profession is for you. It will be nice, and we just encourage you to just find yourself at a health facility so that you help us in this reduction of maternal mortality, and that the fight is not just for us as a people who are giving you the services, but it's for us together, even through information, ensuring that as a community, you are working together, that the women that are there in your communities deliver at a health facility and they get the care that they need, because you have people that are here for you. So we need to ensure that we reduce the number of people that are also delivering at home. And should there be any other issues, I think it would be nice to have the community also reach out and try and bridge the gap so that we demystify the myths and ensure that every pregnant woman who comes enters smiling and lives smiling.
Smiling,
Yes.
great. Esther, under 1 minute.
Thank you so much. So as Midwives Association of Zambia, our plea is that let's invest in midwives so that we have more numbers, take on all those that are trained so that we offer this skilled care to our mothers. Our aim is to reduce maternal and neonatal mortality.
Great. Dr. Kaonga, why partnering with the ministry? Under 1 minute, just.
Together we can do it. The death of one woman is one too many, and we cannot allow this to go on, given that the deaths that we encounter of a woman are preventable. And so we need to team up and ensure that every woman has access to the services that need to be provided. It is important to also understand that these statistics that are being shared have a human face to it. And we also know that for every woman that dies, 20 to 30 other women actually suffer debilitating consequences of basically trying to bring another life into Mother Earth. And so we stand committed to support the government. We've been supporting the Midwifery Association of Zambia to ensure that we can actually provide the quality service that is needed to avert that death and to also avert those illnesses that result from the complications of labor and delivery.
Great. Dr. Karen, your word of appeal as a coordinating part in all this.
Thank you so much. So we are there for you. We'll be everywhere. We'll be in the facilities. We'll also be at outreach sites. And we are also encouraging the women, those that are pregnant, those that are just given birth, and also their babies, to get to our facilities and have services that they need. So we'll be there for you, and we're happy to have you around.
Thank you
Thank
so
you.
much. I hope you carry the media with you as you do your sensitization in all this, so that at least the public may be or might be in the know as to what you are doing. Thank you so much for appearing on our program today.
Thank you
Thank
so
you
much for the
having us.
opportunity.
All right. Well, on that note, we've come to the end of today's program. I had Dr. Karen coming from the Ministry of Health. I also had Esther Banda, who is the Vice President, Midwives Association of Zambia. I had Dr. Wezi Kaonga coming from UNFPA. And I also had Dr. Christine coming from Zago. Well, we're looking at Safe Motherhood Week, and we hope that you have picked one or two things from our conversation today. Let's know and keep in mind that all health matters should be kept, be it online as well as offline. From me, Faith Mutale, and the entire production team, it's goodbye.